Hey everyone, and welcome back. June is Men's Health Month, and while there are a lot of different issues that are specific to men, a common problem that many men will experience at some point, especially as they age, is having an enlarged prostate. Let's talk about it. All right, everyone, let's get into this. So, what is the prostate? So, the prostate is a gland that's located at the base of the bladder. It's about the size of a walnut, and its primary role is to produce a fluid that helps to nourish and transport seminal fluid. Now, when the prostate is working properly, it doesn't give any men problems. But because the prostate is located at the base of the bladder and it surrounds the urethra, as men age, the prostate can become swollen. And when it does, it squeezes against the urethra and it prevents urine from exiting the body. For men that are over 50 years of age, it's actually very common. Some research has shown that as many as 50% of men aged 50, between 50 to 60, have symptoms of BPH. And this number actually goes up as high as 80% for men that are between 60 and 70. Some of the common signs and symptoms of having BPH is either difficulty urinating, dribbling during urination or in between urination, straining with urination, or just not being able to empty the bladder completely. Oftentimes when men are noticing this, they'll go into their doctor and they'll get scheduled for a digital rectal examination, or DRE. Now, during the rectal examination, the doctor is trying to palpate one of the lobes of the prostate to see if it's swollen. But because not all of the lobes are able to be easily palpated via a digital rectal exam, oftentimes doctors will also recommend other forms of testing. For example, a cystoscope. So with the cystoscope, a doctor will insert a flexible scope, and so they'll look inside, they'll look at the urethra, they'll look at the bladder, and they'll look at the prostate so that they can examine and determine what's actually causing the problems where the urine can't exit the body completely. Thankfully, there are many options for men that are experiencing these symptoms. Doctors can prescribe a few different medications. One example is an alpha blocker. With these types of medications, it actually helps to relax the muscles in the bladder neck so that urine can exit the body much more easily. Another type of medication is called 5-alpha reductase inhibitor, and these medications work by helping to shrink the prostate so that it prevents further growth and allows urine to exit the body. If medications don't alleviate all of the symptoms, men can consider a few different surgical treatments. One surgical option is referred to as the transurethral resection of the prostate, or TURP. With this type of procedure, the surgeon is inserting a lighted scope into the urethra and they are resecting or removing all but the outer parts of the prostate. Another type of procedure is referred to as the transurethral microwave thermotherapy, or TUMT. With this type of procedure, the doctor inserts a special electrode which allows microwave energy to destroy the inner portion of the prostate gland that's swollen. When medications or surgical intervention don't fix the problems, oftentimes they will recommend to see a therapist. When someone comes to see me as an occupational therapist, my job is to educate them on what they can do to empty their bladder. And that usually means learning how to use a catheter. There are many different types of catheters that are available, and I know from working with lots of men, just the thought of having to insert a catheter into the urethra can be a little nerve-wracking. But thankfully, when it's done properly and with good technique, and when you're using the right catheter, shouldn't experience any pain, and it should go nice and easily and be able to empty the bladder. So again, there are many different types of catheters. There are straight tip catheters, just like this one here. And then there's curved tip catheters, which are referred to as coude. Coude means elbow in French. It gets that name because the catheter is curved and bent upwards. Here's another example of a catheter that has a coude tip. You can see that the tip of the catheter is curved upwards. So when men are learning how to use a catheter using a coude tip, it's important to educate the patients that they need to keep the tip of the catheter pointing upwards the entire time. The benefits of using a Coudet tip catheter is that because of how the tip is designed and the fact that it's curved upwards, it will actually help to open up the urethra a little bit better and bypass that area where the prostate is swollen so that it can reach the bladder and so that urine can exit the body. This can take time and practice to get down just right, and as with anything, once you've done it several times and more often, it can get even easier and more comfortable. But in the beginning, it's important as healthcare professionals, we provide the support to our patients, we practice with them on different types of catheters, different options, until we can find the one that works best for them, that causes the least amount of discomfort and allows them to be the most independent. All right, everyone. I hope you enjoyed this video. Please like, subscribe, and share, and we'll be back soon for the next one.